Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth, so I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, your host, and today we have a very special guest with us, James White, founder and CEO of KBMO, and I'm going to let him talk a little bit more about that. In our practice, we're centered on whole health, and we're not just centered on teeth, we're not just centered on gum tissues, and we're not just centered on orthodontics and airway expansion. We do know that the airway is a huge part of total whole health, airway and sleep. If we don't sleep well, if we don't breathe correctly, if we don't breathe efficiently and healthy, we're never going to be healthy. But there's a lot of other factors that go into helping our patients achieve optimal health. And one of the things that we have, traditionally looked at is, hey, like we have children with inflamed tonsils and adenoids, we'll have mom and dad maybe get them on a dairy-free diet because we know that a lot of kids have those kind of issues and have a reaction to dairy. We may have them check for mold in the house, mold in their body, and we know those things are very important as well. But until recently, we really weren't looking at, hey, what are the other foods you're eating? And sometimes people can have a negative reaction without even knowing it to foods that seemingly might be healthy foods, and that they think they're doing a great job eating this or that the other, and their individual DNA makeup, they may be sensitive to that type of food. And so how do you know? How do you know if you're sensitive to spinach or you're sensitive to salmon? And what does that mean, being sensitive to a food? And how does it affect me or my children or my spouse? So we're going to have James shed a lot of light on that today for us. So James, I want to welcome you. Thank you for being on with us today.
Well, my pleasure, And you very kindly said we'll do a little bit intro about your background. I'll keep that bit really short because that's not as interesting. But the company name, just to give you an indication, we're talking to the Stewart Center. K stands for Catherine, my wife. B is Ben, my oldest son. I'm just trying to duck out so you can see them. KBMO Diagnostics. And so that's Ben is my oldest son. M is Max, my middle one, as I always say. O is Olivia, my daughter. We saved the best to last. So KBMO Diagnostics. So like Dr. Hal, it's all family orientated, and so we want to make sure that we take it very personally in terms of that's why we want to name it after my bosses, and I'm sure Dr. Hal's got a significant number of bosses that he reports into as well.
I have 5 sisters, so it's born. They're all older than I am.
Oh, they're all older. Oh my gosh.
Yeah.
Hang on, let me just see if I can bring up the share for you. So we'll let me get that going so we can.
James, what is your background from a standpoint of in this healthcare?
Yeah, so my background is I've run healthcare or clinical diagnostics companies now for over 30 years. So I started off in the UK, as maybe what some of you might have suggested from my accent. So I started back in the UK running a number of public companies, and then moved to the US as we expanded into molecular diagnostics and some veterinary medicine, as well as operation room medicine as well. And then I kind of came into diagnostics probably about 25 years ago, and worked extensively in the whole diagnostic arena, kind of mainly in the C-suite in terms of running different companies. Then kind of started working with some venture capital companies in terms of kind of setting those up and selling those, and then got involved in KBMO about 14 or 15 years ago now. So at that point, we had a couple of scientists running a company. They had 3 doctors on staff. We're now at the position we've got 10,000 doctors running the test all around the world. So,
wow.
And the neat thing is it's all cash pay, so there's no insurance. So again, it's one of those things where It's really been very gratifying in terms of the repeat business that we see, and colleagues recommending us to colleagues now. So probably as you find, Dr. Stewart, in terms of with your practice, you feel like you might be pushing water uphill for a while, and then suddenly the dam's open, and you get a lot of referral business. And so we're at that luxurious point now. So, like I always say, we're in a 14-year overnight success.
That's wonderful. Well, let's jump right into it. I know a lot of my patients, when we first started doing this, they would ask the difference between an allergy, a food allergy, and a food sensitivity. Could you shed some light on that?
Absolutely. So IFM stands for the Institute of Functional Medicine. So they're a kind of holistic group who I would say are looking at all different kind of aspects. And as Dr. Howell's very similar to that in terms of looking, as he described in his intro. So I always kind of like to refer back to those guys in terms of a proper way of defining what's an allergy versus a sensitivity, because they're both immunological reactions, but really there's some significant differences. So food allergy is basically an instant reaction. And so think about it, kiddo eats peanut, instant reaction, prophylactic shock, bad things happen. And so an allergy, it's generally pretty instant. So there's no, I wonder what it was that brought that on. It's very much an instant reaction. And obviously the symptoms are very severe. With a food sensitivity, like I mentioned, it's an immunological response, but it can be delayed up to 72 hours. So I'd argue that's why, in many ways, it makes it much more sensible to test for that, because it's really difficult to remember what you might have consumed in a 72-hour period, let alone of the things you've consumed, which one has led to some of the symptoms that you present with. And so I think that's really, for me, the really big issue there is it's that delayed nature, which makes it much tougher for you, the patient, and the provider trying to kind of play detective in some regards of what is it they're eating that may well be leading to the inflammatory response that they're presenting with when you come in and see Dr. Howell.
And a food intolerance is non-immunologic.
It's not. It's just a reaction. So think lactose intolerance, things like that. So you're kind of pretty born with that versus these allergies and sensitivities that can pick up in different times of year. Generally, allergies earlier stage when in your infancy, and some people, as you see, kind of grow out of those a bit. But the sensitivity is something that can happen at any point as well in your life. Intolerance generally, it's a short-term thing. You have it, and then you deal with it straight away in terms of how that works.
And would I be correct in saying that if you had a food sensitivity to a certain food, that would be a inflammatory marker? I mean, that would create inflammation in the body, correct?
Exactly. So with an allergy, generally it's something you have to avoid for your whole life. Generally, if you come up allergic to something because of the severe nature of it, then generally they recommend you stay away from it. With the sensitivities we'll talk about as we go through, the good news is you can reintroduce those foods. So heaven forbid Dr. Howell tests you come up for coffee, don't run for the hills and never see him again. There's a process we can lead to which reintroduces it. So again, that's another one of the differences between those things. It's not forever. It's a period of time, generally 3 to 6 months. The elimination time is 3 months, or as I like to call it, a semester, to try and give people a sense of it's not forever in terms of when you have to kind of eliminate food from their diet.
So why don't you go through and just kind of on your end how this works? And I know how it works on our end. We present a treatment to our patient where the majority of our patients are coming to us because they've got airway or sleep issues and that are related to underdeveloped jaws, an imbalance in the atlas, which is how the head sits on the spinal cord, and they got a lot of muscle imbalance, and we're trying to get all of that back into balance. We are using orthotics and devices that the patient can wear and sleep in that will actually slowly expand their jaws, opening up the airway. And we want to be feeding that body. We want to be feeding their body. We want to be putting them into optimal condition to do that. So a typical treatment plan we would have with a patient is you may need to see an ENT because you've got some, inflamed tonsils, and some maybe a deviated septum that's aiding in your dysfunctional breathing. You may have small jaws, so we're going to start you on a program to expand your jaws. But we also emphasize a healthy, very healthy lifestyle and diet while we're doing this. And so, again, if a patient's going to commit to what we're doing and what we're recommending for them, we want to make sure that they know what foods they need to stay away from, or at least at first, and what foods are they're very tolerant of. So we then would recommend, hey, we recommend this company KBMO. We have the kits here. You can do your finger prick while you're here in the in the office,
Yep.
and get the blood samples to the lab, and in a couple of weeks you get your results. So that we've been offering this now for a few months, and it's been very well accepted with our patients. So tell me a little bit about what goes on your end. We
Sure.
send the test in, or the patient sends the test in, and then what happens?
Yeah. So let me go into terms of how the test works so you can kind of get a sense of it. So this slide may be a little bit intimidating, but don't panic. Just hold with me a bit. There's a lot of testing out there which is measuring, I think, what IgG, which is an immunoglobulin testing. And what we do is we don't stop at that point, because what we've worked out is that just tells you which foods you're exposed to. So what we want to try and do is, what's the underlying cause of some of the symptoms the patients present with that you just went through, Dr. Howell? It's inflammation. And so what we do is we don't stop at measuring the IgG element, which is the test that you can generally find on the internet. Is we go on and we measure these things, this thing called complement activation, with a marker called C3D. And so it's a combined pathways that we're measuring. So we look at the IgG, which tells Dr. Howell and myself what you're exposed to. But then, more importantly, where the magic happens is we then go on and look at the complement activation to see, of that long list of foods you're exposed to, which ones are causing inflammation. Because all of those symptoms that Dr. Howell went through, the underlying cause of all of them is you're inflamed. So what we want to try and do with this test is work out which foods on an individualized basis are leading to that inflammatory response. And so that's what this test does, and that's the unique element. So it's not just measuring exposure, we're going on to measure which foods cause inflammation. So if you want to think about it in its simple terms, it's a two-screen process, i.e., what is it you're exposed to, but then, way more importantly, of that long list of foods you're exposed to, which ones are going on to measure some kind of like inflammatory response. So from a technical standpoint, it's saying, rather than just looking at the acquired immune system, we look at the innate immune system. And it was best described to me really from one of our providers in Ohio. She said to me, James, what I love telling my patients about this test is it measures the whole immune system versus half of it. And so think about it in those terms, in terms of how this is different from the IgG only test. The other key element is, again, sorry to bamboozle you with too many kind of pictures and diagrams, but on the left-hand side, we've got these IgG only. So lots of companies out there on the internet offering IgG only testing. On the right-hand side, you've got this multiple pathway test, which Dr. Howell has implemented, which is the KBMO test. It is the only patented food sensitivity test on the market, and it's only available through providers, because, again, we want to make sure that as you get these results, as Dr. Howell was talking up front, he wants to see it holistically in terms of what's going on within your body. And so these foods that we identify will show you which ones they identify. So a good example of this is, if you wander into any store, you may see a company called Everlywell, and they measure a test, which is an IgG only test. And so, again, as every small business owner knows, we're a guinea pig, and we have to do many different things to keep the lights on. So one of the things I did a year or two ago was I did an Everlywell test, which is this single pathway approach. And on the same day, I did my complement test. And what happened is, when I got the results back, I had 24 plus foods on the IgG, because you think about it, it's only telling you what you're exposed to. But when you looked at which one was exposed to and then leading to the complement, I came up with 5. So it shows the importance of running this test, and the smarts of Dr. Howell to pick it, because it helps eliminate, in technical jargon, a thing called false positives. But for you and me, the patients, what is key is it means it's zeroing in on the key foods which are causing you inflammation, not exposure. Because, again, we've all got to be exposed to stuff. And as Dr. Howell quite rightly points out, he wants you guys all to be eating healthy foods. But how do we define that? So this test is a great way of working out on an individualized basis which foods are healthy for you, and they may be different for Dr. Howell than from myself. And so that's the key with this test. It's an individualized way of working out which foods are causing inflammation and which ones you guys are perfectly safe to be eating. And so then you can keep going in your normal life.
So if someone is sensitive to a certain food, let's say salmon, they would typically eliminate that for what, a month?
Yeah, great example. So what we're
it-
measuring is, as you say, Doctor, let me pull up a set of results so you can see it. So this is an example of a patient report. So for example, if it was elevated for salmon under the fish here, and it was, let's say, a red one, and again, the idea is with the report, it's very simple. It's 3 pages. Front page tells the patient the ones to eliminate. The second page is this Manhattan, and again, it identifies are there any groupings going on. So red is severe reaction and green is no reaction. So we'll take salmon as an example. If it was a red, you basically, what we found from working with many providers and some of the clinical trials we've done, is if the patient eliminates those foods for 3 months, hence my example of earlier of the semester, you take them out for 3 months, and then you can look to reintroduce them after that 3-month period. And if the symptoms return, you may want to keep that food out for a longer time period. But if the symptoms don't return, great news is you've healed your gut and you can move on and try some of the other foods that you might have been associated with as well. I'll just, whilst we're on the side, I'll just kind of point this thing out as well. So we're measuring all organic foods. They're all sourced organic. We're very deep in terms of knowing where they came from. So I can even tell you who caught the mackerel, which is on our Fit 176 test, for example. So, but one of the other things we do is, as Dr. Howell mentioned, he looks at mold in housing and stuff like that. But one of the other things that's kind of crept into the kind of daily world that we all live in is colorings and additives. And to think about them in a kind of 3D world. So they're in processed foods, they're increasingly in supplementation. And thirdly, you'll see them in personal hygiene products. So a good example of that is we had a 10-year-old boy who one of the providers was telling me about, who was elevated on benzoic acid, which turned out was in his mum's washing powder and the shampoo that they were using on him. They eliminated that. He was really lethargic. So after about 6 to 8 weeks, he returned back to his normal 10-year-old bouncing off the wall self. So the reason I kind of highlight that is, you know, these things can be in many different places. So you need to think about it, not just what you're consuming, but what's touching your skin as the third barrier as well, in terms of kind of some of these personal hygiene products, and a supplement as well, in terms of they're increasingly being seen in some of those things as well. Sorry, Dr. Howell, just to bring it back to you.
So from a practical standpoint, if this is my report, it's kind of hard to see the foods on the other. All of those little bars are different types of foods.
Yeah.
But if this were my report, and let's say benzoic acid was not green, let's say that was red, meaning I was highly sensitive to it,
Yep.
then I would look anytime I go to the grocery store to buy any kind of food or processed food, especially, I'm going to be looking, is there benzoic acid in it? And if there is, I'm going to stay away from it.
Correct. For that 3-month period, and
Yeah.
then look to start eating foods which have that 3 months down the line. So again, the nice thing is, I think the other thing we've tried to do with this report is keep it simple. So we want patients to understand it. So sometimes, as a patient, you'll get a 30-page report and it's kind of bamboo, it's kind of confusing. So the idea here is to keep it short, keep it simple, so that the patient can go, okay, I know what I need to do. I need to eliminate those foods. The other thing we've done is we provide a meal plan as well. So we try and give the patient a way of, look, here's some ideas of what you might want to consume, because what we were hearing from providers was, love this test, but patients were going, oh my God, doc, what can I eat? So the concept was, let's provide them an individualized 7-day meal plan. So then that way you've got some ideas of what you might want to consume. And again, compliance is really key for us. So the other thing we did is we then put it on your phone. So the idea is, again, you mentioned it. So what happens when the results come to us? So we run them on a ELISA technology, it's called, which is kind of a very stable and well-established technology in a lab, which is a kind of clear high complexity, which means it's state and federally inspected. All the plates we make are in an FDA registered manufacturing facility as well. So all done under the highest quality areas. And then once that test has been run on these ELISA plates, where we're looking for a kind of colorimetric change on these, which then leads to that bar graph, we send the results back to Dr. Hal. And then generally 14 days after you've had the opportunity to walk through the results with Dr. Hal, we'll send you via an email this app. And so on the app, it's got the meal plan. So again, if you're grocery shopping, you can go in and kind of use that meal plan as a way of the app as a way of checking that. You've got your full test results. So again, if you want to check to see what you were sensitive to, you've got that there. And for each of the individual foods, we also show you what it might cross-react with, where you might find it, and then some alternatives and substitutes. So to give you a little bit more information, but just on the foods that you're sensitive to. Now, the other great thing about this test, and I think one of the reasons I think lots of clients really enjoy it, is there's no judgment attached to it. So again, it's not like, oh my gosh, none of us are going to share. My cholesterol was through the roof, and I'm really thrilled to tell you all about it. With the food sensitivity test, there's no judgment. It's if you happen to be elevated for eggs or salmon, as Dr. Hal was suggesting, it's an interesting talking point with your friends and family. And so what we often find is one of the family members or friends in a friend group does the test, and because it's on their phone, as we've all seen and kind of witnessed in every restaurant across the US and around the world, everyone's looking at their phone. So it's an amazing thing how that kind of gets brought up over dinner, and before you know it, you've got everyone talking about, oh my gosh, I think I'm sensitive to this, I'm not sure. Go see Dr. Hal. He runs that test, and it's a really fascinating bit of information to improve your longevity, improve your overall health by looking at which foods on an individualized basis are causing inflammation.
Fantastic. For James, for those that are listening to this, because we have viewers all over the world that aren't patients and don't have access to our practice, how would they go about getting tested through KBMO?
So they could certainly reach out to yourselves in terms of at your center, or they can just contact KBMO Diagnostics at the info@kbmodiagnostics.com. And we've got a number of providers who work with us all around the world, but a couple of providers in the US who we set up to do remote kind of consults with patients. So they'll find that that's a really good way of doing it. Again, not many positive things came out of COVID, but I think that was one of them. The neat thing with the test, as Dr. Hal mentioned, is it's a finger stick, so it's really easy to administer at home. It comes with a neat little video which shows you how to do it, or you could, if you're seeing Dr. Hal, you can do it in the office, which is always a good way of doing it as well. But it's very easy to do.
For those of you that are afraid of needles, it's not a needle. I promise.
Yeah, you don't even see the needle. So this is the device we're talking about. It's called a finger stick. So it's really easy to see, and you just literally twist it, and then you kind of apply it to your finger, and then before you know it, it's good to go. And what you're then going to do is you're going to drop the blood onto one of these little ELISA cups, onto this little blotting paper, which hopefully you'll see here. Yeah. So there's 5 spots on here. These backgrounds are great, apart from it looks like everything's invisible. There we go.
Well, yeah, you can see it briefly there for a second, right there. Yeah.
So anyway, so you drop the 5 drops onto there, and then that gets mailed back to us. Now, the good news is we've got offices all around the world. So if you happen to be in Europe, you'd probably deal with our UK office, and we'll take care of that for you. Again, if you're in Canada, that comes directly back to us in Boston, where our offices are located. And we've also got labs now in Latin America, in both Mexico and Brazil. And we've also got labs in Asia, in one in Beijing, another in a place called Chengdu. So we're pretty well covered around the world. There's not many places that we can't take samples from. So, and again, the nice thing is the sample is stable for 30 days. So again, it makes it really easy in terms of shipping. So again, it's not kind of, hopefully not very expensive in terms of the shipment of the test back to us.
Yeah, it's very intuitive and very simple. Everything comes in the kit, the package you put it in, the mailing label, everything. So they make it very user friendly. And drugs are a huge problem all over the world. What people don't think of is the most potent drug we put in our body is what we eat and drink every single day. For the average person out there that aren't addicted to the real serious drugs that are such a problem in the U.S. and other countries. But if we think of food as a drug because we ingest it and then it has an effect on our body, we don't think of that necessarily a lot. And so we know, you shouldn't eat junk food, you shouldn't drink too much alcohol, you shouldn't eat a lot of sugar. That's kind of common. But who would think that maybe a food that you might feel is really healthy for you, uh, not that it's not healthy for you, you might be highly sensitive to it, and it could be a detriment to you. And what you want to know about that? It's a very easy way to find out. And yeah, I'll talk a little bit about the gut barrier panel too. This is an
Yeah.
added benefit of using KBMO.
So one of the things that what we used to see was that some providers would say, look, we love this test, it's patented, it's eliminating all those false positives to make it easier for patients to be compliant, which is really what we're all looking for at the end of the day. But some of them, they would say, look, I think my patient has leaky gut, so we don't run a food sensitivity panel. So that kind of stuck in my mind a bit. And so, rather than guess, why don't we come up with a test? And frankly, in their defense, there wasn't any good tests out there 10 or so years ago when I was hearing that. So we've developed this gut barrier panel, which is a great way of working out, do you have leaky gut or not? And so that way, again, if you think back, why would I be interested in my gut? Thousands of years ago, what the ancient Greeks would say is all disease begins in the gut. So the idea is, can we work out what might be going on from an immune health standpoint? And again, immune health, something none of us understood before, the minor issue of a pandemic. Now we're always all a bit more familiar with that stuff. So the idea is with this test, can we give a kind of quick, a quick check on what's going on from an immune health standpoint by measuring to see what's going on to see whether you have leaky gut or not. And so again, without trying to kind of confuse anyone too much, the idea with this panel is we're looking at candida, which exists everywhere in the body anyway, but to work out, do you have any early signs of a thing called dysbiosis? And then the zonulin and occludin, again, they're looking at your tight junctions. So basically before the food and blood goes through your system, it has to pass through tight junctions from your gut through to your bloodstream. So the idea with that is zonulin measures how well those tight junctions are functioning, so they're opening and closing appropriately. And then the occludin is, are they structurally staying together or are they beginning to come apart? And the third one, LPS, is a thing called lipopolysaccharide. So again, it's what's going on in your gut for all the gram-negative bacteria that exist. So the idea is most of them are gram-negative bacteria, a great way of checking what might be going on. And again, just quickly, the IgA market is basically means, it's an early stage marker, it's a secretory marker, and it's generally found localized in the gut. So if any of these markers are elevated on the IgA panel, generally means early stage, still localized in the gut. If things come across this IgG complement, generally means more systemic, been around longer term, and so those symptoms can be more systemic as well. So, but a really good add-on to work out and give the provider and you, the patient, ooh, hang on, it's not all these foods that are inflaming me. I've got a leaky gut. Let me heal the gut, and then the provider can then look at working on those foods that are causing inflammation as well.
And the Fit 132 is a test that measures, or that tests for 132 different foods, and Fit 176, which is what we offer our patients. It's 176 foods, and then both of those include the gut barrier panel test as well.
Exactly. So these are all the foods on the test that Dr. Howell measures, which is the 176, and then the smaller versions of that, so the 132 and the 22. But what we found is most providers now have moved to the 176. It's more comprehensive. We look at some of the foods which are included in some of those supplements, as well as some of the powders and things that providers offer. We've included some of the main ingredients of some of the key supplements, so things like omega-3. So we've got mackerel in there, sardine and anchovy, which are the main ingredients of omega-3s, which are very commonly prescribed. We also included CBD on there because, again, a lot of people prescribe that. So we want to make sure that, patients aren't going to have a sensitivity to that. And things like goji berry, monk fruit, and stevia, which are in those powders, we want to make sure we test those because we don't want patients being put on these things and actually getting worse because actually some of these things were in there. So again, a number of different foods are in there, like Brussels sprouts and kale, which again 20 years ago weren't so popular. But I'm not sure there's a restaurant in the US now that isn't serving Brussels sprouts. So again, want to make sure we include that as well as some of the more healthy foods that patients are consuming.
Great. We're very excited to be able to offer this to our patients. So any doctors that are watching this, I would highly suggest you contact KBMO if you're a patient and you don't have a provider. Again, go to kbmodiagnostics.com and they'll get you set up with somebody. You said you have about 10,000 practitioners now.
Yeah, so there's 10,000 providers all around the world. So we're very fortunate in terms of how we've managed to grow the business over that time. No shortage of trade shows. I'm sure you'd appreciate that, Dr. Howell, in terms of growing the number of providers, which has been a wonderful thing. And again, one of the highlights of my job is actually talking to providers who are running the test or looking at running the test, given the kind of strength of the results that we've seen. So again, it's always a nice thing to kind of to be able to get on and help spread the word from some of the great providers like yourself who are using the test.
Well, this is fantastic, James. I appreciate you coming on today, and I hope that this podcast will reach people that would maybe never have thought about this, or practitioners, because what we put in our body every day is food. All of us do that. We have to put some sort of food in our body, and if we're trying really hard to be healthy, we want to make sure we're putting the foods in our body that we're the least sensitive to, and that we're going to give us the biggest bang for the buck, if you will. And also gut health. We all know how important that is. So, James, I appreciate everything you're doing. I guess you had told me before what KBMO stood for, but I had forgot about that. So that's wonderful. The company is named after the people that are most important to James, and that's his wife and his kids. So that's amazing. James, thank you so much. As I get further into this with my patients, we may have you back on in 6 months or a year, and I will be coming at this from a different perspective, because I literally this is pretty new in our practice, but I'm ecstatic about it. So I appreciate everything that you're doing there, and I'm glad that our paths cross.
Wonderful. Well, thank you again, Dr. Howell. Much appreciated. And thanks everyone for taking the time to listen to this. And again, look forward to kind of hopping on in another 6 months and maybe going through some of the case studies that Dr. Howell will have by that point, and some of the supplements that we can add to this, as well as how things have gone from a leaky gut, as well as hopefully reducing inflammation for those patients and seeing a great improvement in their overall health, whatever that journey may be.
What are some, just while I have you on here, what are some, like if somebody comes to me with TMJ issues, they're going to have headaches, they're going to have pain, they're going to have tight neck, sore neck, food sensitivity symptoms are, what are things that a patient could be looking at? Well, you just put them up. So, you had said something, eliminate the food, see if the symptoms go away. Sometimes people don't even really know what their symptoms are. They just feel bad. So these are like things that I would like to tell my patients.
So what I can do is we can send you, I'll send you this slide laminated if you want. So you can say, look, these are some of the symptoms. The underlying cause of all of them is inflammation. So, but it's quite tough to tell a patient, are you inflamed or not? Because they don't really know what you're talking about. That's why when you say, look, here's a list of symptoms, and I've got a better one which shows even kind of longer list of kind of typical symptoms that lead to an inflammatory response. So that may be something that you can use in the practice, which you can say, look, do you suffer from any of these? Because if you do, then maybe we should consider, doing a food sensitivity test to see, are they actually impacting, what I'm seeing, when I'm spending time with the AB.
So the company is KBMO. It's KBMOdiagnostics.com if you want to learn more. I hope you guys have a great day. This has been Health in Harmony Beyond the Teeth. I'm Dr. Hal Stewart. And I want to say thanks once again to our guest, Dr. James White, founder and CEO of KBMO Diagnostics. Thank you. You guys have a great day.
Thank you very much. Thanks everyone as well for listening.